Hi there, everybody. My name is Jared Milrad. I'm the founder of Movikarma. We're a nonprofit organization based here in Los Angeles, California. We focus on fostering equity, inclusion, representation, as well as social impact in culture, society, and beyond. We do that in part by empowering underrepresented voices and talent, particularly in the creative industries in the US and globally. And today, we're really excited to have a very special event, our first event of this kind called the Trans Equity Summit. The summit is an opportunity to really focus on transgender equity issues and equity issues more broadly that affect the transgender community across the country. And we're very, very proud and excited to have an incredible group of panelists joining us today, including, and I'll go through each of our special guests today, Admiral Rachel Levine, who serves as the 17th Assistant Secretary for Health for the U.S. Department of Health and Human Services under President Joe Biden, and is also our nation's highest ranking openly transgender official. Welcome, Admiral Levine. Dr. Jerrica Kirkley, who is the co-founder and chief medical officer of Plume, the first digital health company dedicated to the transgender community that provides gender-affirming hormone therapy at the convenience of a smartphone. You can learn more at getplume.co. And also Kris Hayashi, who is the executive director of the Transgender Law Center, one of the largest organizations in the country advancing the rights of transgender and gender nonconforming people. So welcome to all of you. Thank you so much for joining us. Let's dive right in. I know Admiral Levine has a cutoff at about 30 after. So first, and also welcome to all of our guests as well. You can ask questions, those of you joining in real time throughout the panel today. First, let's talk a little bit about each of your personal journeys, if we could. What made you decide to or move towards a career either in health or law, and focusing on issues involving equity and transgender equity specifically? Admiral Levine, let's go to you first.
Well, thank you so much, and I'm really pleased to be here. You know, my field has been pediatrics and adolescent medicine, and I had a career in academic medicine at Mount Sinai in New York City, then Penn State for many years before I came to public service and to public health. And I've always been interested and particularly motivated by that intersection between physical medicine and behavioral health, and traditional medical issues and mental health issues. And so that has always been the focus of my career, first in academic medicine, but then I had the opportunity to go into public health as the physician general, and then the Secretary of Health of Pennsylvania, and then this amazing opportunity to join the Biden administration as the Assistant Secretary for Health. And so, you know, I think that health equity is just critically important, especially at this juncture. It is absolutely one of our top priorities in the Biden administration, and that includes, of course, health equity for the LGBTQI+ community. And now more than ever, we have to emphasize that and to work against some of the forces that are challenging us.
Thank you, Admiral. And building on that, Dr. Kirkley, I've obviously known you, just full disclosure, I've known Dr. Kirkley for almost 20 years, I think, at this point, going back to college. I know health equity in general is something that's been incredibly important to you for many, many years. Talk a little bit, if you would, Dr. Kirkley, about your experience with not only health equity, but equity in general, and also just a little bit about your personal journeys. I think a lot of folks would be interested to hear that.
Yeah, for sure. Thanks, Jared. Thanks for having me on. I think I first really got interested in healthcare and medicine towards the end of high school and in my early college days, because I really saw it as a vehicle for social justice. I saw a lot of communities around me that were underserved, but I was also inspired by movements like the medical wing involvement in the civil rights movement, where we saw federally qualified health centers come out of the work of a lot of amazing individuals within healthcare, but people like Paul Farmer come to mind, where this unapologetic dedication to the individual patient, but also to changing the system, so that all people can live healthier lives. And so that was always my motivation. Didn't know how it would turn out, but ended up doing a family medicine residency. And that was the first time I had the opportunity to actually provide care to trans folks and provide things like gender affirming care as a physician. Opened my eyes up to a process that was incredibly powerful to be a part of, but also a big gap in care. And so continued that motivation to try to find ways to close those gaps in access to care, certainly for trans folks, and thinking of equity broadly for all communities. Personally, I came out as a trans person about 3 years ago, and so I think I've reflected on that a lot, and have seen like a lot of repression, certainly in my earlier life. But there's been a lot of neat intersection with the work that I do as a physician, providing care to trans patients, and walking through that myself and seeing some of those barriers and challenges that I faced personally, but also through the eyes of now thousands of patients. And that was ultimately what led me to start Plume, to really think of a different way to find access to healthcare for the trans community.
Thank you, Dr. Kirkley. Yeah, that's really incredible work, and we'll have to dive more into that and your work at Plume in a bit. Kris, if you could build on this from a legal perspective, how do you think about legal equity for the trans community, but also share a little bit, if you would, about your personal journey on these issues?
Yeah, absolutely. Thanks so much for having me here today. And I always like to say this at the start of these. I'm actually not a lawyer, but I do work with a lot of lawyers. So just that caveat. Yeah, so just a little bit about myself. So, I grew up in Seattle, Washington, and I was always a super gender non-conforming kid. And I was really fortunate in that my family was pretty okay with that. However, I think it's true for a lot of trans folks, like that really changed when I went to school, and definitely faced a good amount of kind of intolerance and harassment as a young person. And, this was such a different time. This is definitely dating me, but this would have been like, in the 80s. It wasn't when you could just like go to your laptop and type in trans into Google and have all this information pop up. So, I really didn't have the words to describe who I was, but it was really clear to me that the world was not set up for me to survive and thrive as a trans person, as an Asian trans person. And so, I really carried with me this sense of injustice, even from a very young age. And so, I really took that to me when I moved to California, and this would have been in the early 90s, and got really involved in a lot of the youth-led organizing, the youth of color-led organizing that was happening in California at the time, because there were just a lot of horrendous propositions like anti-immigrant, anti-LGBT, anti-youth, and there was really powerful organizing led by young people, folks in the streets, protesting, getting folks out to vote. And it was the first time that I really saw that there was something that all of us could do about the injustice in the world, about the injustice that I had experienced. And so that really led me to where I am now at the Transgender Law Center, and really fighting for rights, justice, and liberation for trans people.
Thank you, Kris. And again, incredible work. I'm looking forward to diving more into all the work that you do and have done. Let's go back to you, Admiral, if we could. We had some great questions from the audience here joining us live around the recent executive order, which is, I think, quite historic, that President Biden signed, advancing LGBTQ plus equality. Could you explain a little bit, Admiral Levine, about what this order does specific to the transgender community and equity issues, and how, I know you're going to do some travel shortly as well to fight back against some of the discriminatory laws. So part two of that question is how can we fight back, and how are you as part of the administration fighting back against some of these discriminatory and hateful laws against the trans community?
I was muted. Absolutely. We have so many challenges right now, particularly in the States. And so, it's remarkable. We have a president and a vice president who see us and who affirm us and support us. And it's a remarkable time. And so the president did sign an executive order last week outlining a number of ways that different departments are tasked with supporting the LGBTQI plus community, particularly against these politically motivated state actions. So at HHS, we're going to be working to push back through our advocacy, through our policies, for example, Section 1557 of the Affordable Care Act, and to be inclusive in terms of sexual orientation and gender identity and trans-affirming care, as well as through legal actions, particularly through the Justice Department, also the Department of Education in terms of Title IX. So he's really tasked us to come up with specific ways that we can push back against these politically motivated actions and support our general community. Advocacy, I think, is an important one. As you mentioned, I'm going to be in Florida next week on Monday, and I'm going to be talking in Orlando and then Miami specifically about some of the very regressive actions taken by Florida in regards to their Don't Say Gay bill, as well as their actions against trans-affirming care, as well as their actions against immunizations of children against COVID-19. There's so many, it's hard to know where to start. So we're going to be talking about that, but then we have to work through policy and through the legal front, all of it together in order to advocate for our community.
Thank you, Admiral. That's really helpful to give us some insight in terms of what the department's doing there. I wanted to build a little bit on that, dive a little deeper, Admiral, if we could, in terms of specifically with trans children and trans youth, because we know, as you mentioned, there's been particularly harmful attacks at the legislative level. I know, Kris, you've been working on this issue, Dr. Kirkley, of course, as well. Could you talk a little bit more, Admiral, specifically about what some of these, for folks who don't know, what some of these legislative attacks have been against trans youth regarding healthcare and other issues, and if you could expand on in any way, what the administration is going to do or is doing to help to protect those folks.
Well, thank you. It is so important for us to advocate for and to empower vulnerable transgender youth, gender non-binary youth, and their families who are so at risk of bullying and harassment. Unfortunately, because of politics, there are a number of states that are taking actions and laws that are harming those members of our community. Specifically in Texas, it wasn't a law, it's an action from the governor and the attorney general actually weaponizing child protective services to investigate parents who are doing nothing more than supporting their kids and investigating them for child abuse. It's a particularly insidious use of child protective agency. The other is in Florida, their Don't Say Gay bill, where schools and teachers and other school professionals in education are unable to really talk about themselves and to really empower and listen to trans youth. That's in the face of the Trevor Project, which states that even one supportive adult can make all the difference for a transgender youth or a gender non-binary youth. And it's really prohibiting school personnel from being that one supportive adult. There's a law finally in Alabama, and there's more, but where they have said that adolescent medicine, pediatricians, pediatric endocrinologists, even at children's hospitals, if they're providing gender affirming care, that would be a felony. Now, our Department of Justice participated in a lawsuit against that and wrote a brief against that, and that's currently stayed. So, there's so many issues. I think that there are two barriers that we have. One is that people tend to fear the unknown, and I'll because this is Hollywood, I'll quote a movie from Yoda from Star Wars that fear is the path to the dark side. Fear leads to anger, anger leads to hate, and hate leads to suffering. And so I think we have to get past that for people and to educate people. That's what I try to do. I know that's what you all try to do. But then I think that there are political figures in these states that are preying upon people's fears and weaponizing their fears, and that is leading to these politically motivated actions. So again, we all have to stand up and to fight back.
Yeah, thank you, Admiral. Good quote. Very, very relevant as well, for sure, and timeless. Dr. Kirkley, I wanted to build on that with you, and then get to Kris. What are the impact? We've talked about this, of course, a bit online as well, but and offline. But what are some of the impacts you've seen, Dr. Kirkley, on the youth that you're serving, the patients that you're serving, providing gender affirming healthcare through Plume, and also I wonder if you could comment just on this is affecting quite a few people. I think sometimes we maybe undervalue how many many individuals it's affecting. There was a new study I know you're aware of from the CDC, based on CDC health data, that found an uptick in the number of teens who identify as trans or non-conforming. So if you could just talk about some of those issues and the impact you're seeing on in the patients and folks that you're serving in terms of these discriminatory actions and laws.
Yeah, for sure. So at Plume, currently we're serving those 18 plus. We are a completely virtual platform, so navigating some of that complexity around parental consent state by state, and of course with an eye of pushing that forward and trying to cover care for more ages as we go along. But the impact on patients is the same across the board, and I've cared with youth in other settings outside of Plume, and it can create a lot of fear and concern, and also ambiguity, especially as Admiral Levine said, when you have things that are not even law, but sort of statements that are put out there that encourage certain behaviors, it can create a lot of confusion. And so certainly have patients who will message us, who will call in, and just asking, what does this mean? What does this mean for me? How does this impact my care? So we do a lot of certainly providing guidance and counseling on that. And a lot of advocacy, and speaking out against, of course, these horrible things that are coming through, and encouraging legislators to try to take action there. But yeah, it can have a lot of downstream impacts on all people and on all trans people, I think, regardless of age, background, et cetera. And whether they're directly impacted by a certain law or not. Because what we do know is it can lead to just increased discrimination and bias across the board. Which I think is one of the reasons why we really wanted to create a virtual and safe space for care that folks can access in a place that's comfortable to them, knowing that the environment can change drastically and quickly in a physical setting.
Thank you, Dr. Kirkley. That's great. Kris, I wanted to go to you. Admiral Levine mentioned some of the laws or proposed legislation that the administration is fighting back against. I know your organization, with some others, I believe ACLU, Lambda Legal, has been fighting against some of these proposed laws as well and bills. Could you talk a little bit more just about your work at the Legal Center and some of the other services you provide? I know you're involved with gender marker changes, name changes, some of the other services you offer.
Yeah, absolutely. So for TLC and the Transgender Law Center, we both do impact litigation. So we particularly prioritize the ways in which trans communities face criminalization, which folks have been speaking to a lot of the ways the bills currently do that. We also have a legal help desk where anyone can call into. Most of it's online these days, if folks are in need of legal information, resources, or support. What I would want to add to this conversation is that I think it's important to raise up that this escalation in anti-trans state level legislative and policy attacks is absolutely not new, that we've been facing these types of attacks for over a decade at this point. One of the first attempts was actually here in California in 2013 or so. So I think it's important to name that, and that there are very well-resourced conservative forces that have been backing these attacks. And that what we've seen in the last couple of months, while there's been an escalation over a period of time, the last couple of months has been an extreme escalation, like nothing that I've seen in the times we've been fighting these bills, which has been a good 7 or 8 years at this point. And I guess what I want to particularly raise up, in addition to what other folks have shared, is the real impact that this has on trans leaders, on trans communities, on trans young people and their families, that we've been facing ongoing bombardment of attacks against our rights and lives, from the last federal administration to now at these state level attacks. And folks are absolutely exhausted and terrified. And when the Texas Attorney General, backed by the governor, issued that statement, it was within days that investigators started to show up at the homes of families who support and love their transgender children. that folks are absolutely terrified. And then it was just a couple of weeks later that Alabama passed what is the worst trans healthcare ban we've seen, making it a felony to provide care. And then it was just a couple weeks later that Florida issued guidance basically against all gender affirming care, including socially transitioning. So I just think it's important to, one, like name the broader context of the really extremely well-resourced forces that we're up against, and the real day-to-day life impacts on trans people and communities, to what others have shared, that even when the bills don't pass, right, more states had anti-trans legislation than didn't this year. So even when those bills don't pass, the impact for trans people in those states to be bombarded with anti-trans rhetoric and hate is absolutely devastating. So I would just raise that up.
Yeah, thank you, Kris. It's really important to raise up. And I think that brings a good question for you, Admiral. You mentioned the ways that the administration and you personally are working to confront these discriminatory efforts in many states, as Kris mentioned. Could you talk a little more? Are there other ways do you think that the president and the administration, and even you in your role, can use the bully pulpit to maybe even be preventative or educational on, who transgender individuals are, why these types of attacks are an affront to the Equal Protection Clause, to the founding of our nation in so many fundamental ways? I just wonder, do you think about, I imagine you do, but just more broadly, what other ways, soft power, if you would, that you can use to try to foster more equity, understanding, empathy for communities that are under these attacks?
Well, thank you so much. I mean, I think that's exactly what we intend to do. We need to use really the full power of the federal government to do that. And that is the basis behind President Biden's historic executive order. And it was such an honor to actually stand there on the podium while he signed the executive order. It is really a specific order authorizing all of the different departments of the federal government to specifically push back against these regressive, politically motivated and dangerous attacks in the states. And so, for example, the EO includes a step to address conversion therapy, to address youth mental health, to address these legislative attacks against children and families, trying to work to safeguard healthcare and prevent youth suicide, tasking the Department of Health and Human Services, the Department of Education, the Justice Department, and more to be specifically doing that. And so we're going to do it through the legal department and the Department of Justice, do it through Health and Human Services and the Affordable Care Act, Title IX for the Education Department, and then our advocacy. Secretary Becerra has spoken out frequently about this issue. I believe he'll be doing so again next week. I am going to be on the road doing that, and we're going to continue these efforts to try to protect the most vulnerable in our community, particularly in these cases, trans youth. It's also important to remember that we have to deal with violence against our community. Transgender individuals of color, trans women of color are at risk of not just harassment, but they're at risk of violence and murder. And so we have to act on that. And so there's so much work to be done, but we have such support in Washington right now. It's such a unique opportunity, and we have to take advantage of that. And that's exactly what we're going to do.
Thank you, Adam. I have two last questions for you before I know you have to leave. One, a great question from our audience here around encouraging the FDA to include guidelines about the inclusion of trans and non-binary patients in clinical research, which I think brings up perhaps a broader question. I wonder if you could address just how are you working in an interdepartmental way across the administration to foster more inclusion and equity in terms of how the broader administration is doing this work.
Sure. So, diversity, equity, and inclusion are really the hallmarks of the Biden-Harris administration. It is absolutely the top priority for Secretary Becerra. And so it isn't that we deal with different issues, for example, at HHS, like we deal with COVID, we deal with mental health, and then we deal with health equity. Health equity is actually foundational It is embedded in every single action that we take. It is embedded in every grant, every funding announcement. Health equity has to be included, and we have to show how we're including health equity principles into every single step, every single thing that we do. I think that through our LGBTQI+ coordinating council at the HHS, we're making sure that we include data and SOGI data in terms of all of our different data collection mechanisms. That was actually specifically taken out in the previous administration. They were literally trying to erase us, and we will not be erased. So we are working to build all SOGI data collection, state-of-the-art type of questions as depicted by the National Academy of Science, Medicine, Engineering recently in a recent report. So state-of-the-art collection mechanisms of SOGI data, in a sensitive way, in a culturally sensitive way, so that we can use data to help us. Without data, then money doesn't flow, and it's very hard to support our community. Data is power. And so we're going to be collecting that data as well, whether it's FDA, NIH, CDC, and really across all of our different divisions at HHS.
Thank you, Adam. It's really helpful. I hope that helps address the question. The last question I had for you was just if you can give us a little bit, I guess two-parter here, if you can give us a little bit of the view forward. What do we have to look forward to in terms of initiatives the Biden administration perhaps is working on that affect trans equity issues? And connected to that, we have a great question here around how LGBTQ+ individuals or allies in blue states or in parts of the country that perhaps are more historically supportive of the community can be involved. How can all of us be engaged and supportive of what the administration is doing?
Well, so for the future, again, we're going to be working with our coordinating council, our LGBTQI+ coordinating council, on many of these different aspects. So for example, the Office of Civil Rights is finishing up their rules and regulations first report about section 1557, stating that when it says you cannot discriminate on the basis of sex, that includes sexual orientation and gender identity. It then goes out for public comment. Then they have to include all those comments and revise it, and then it'll be promulgated. And that will inform every action through HHS, according to the Affordable Care Act, including CMS, the Center for Medicare, Medicaid Services, HRSA, and others. So that's going to be absolutely landmark. The data collection efforts we kind of talked about. So again, conversion therapy, working against conversion therapy with SAMHSA, Substance Abuse Mental Health Services Administration. So all of those are going to be now and in the future. I think that people need to advocate. I think that advocating in more progressive states is really critical. And I think they need to advocate in less progressive states. I think that they need to hear from our community, and they need to hear from our community at the local and state level, not just the federal level. We have had real challenges at school boards and city councils, and that's where a lot of those local actions are starting, and then they percolate through the state. So I think that we need to organize and to advocate and to be politically powerful at all levels in states, whether they're socially progressive or regressive states. And we have to take back our power.
Thank you, Admiral Levine. It was an honor having you. I know you have to run on behalf of Movikarma. We do a lot of the cultural equity work. I know Dr. Kirkley and Kris do incredible work in health and law. And so I think all of us are really grateful that you took the time and for all the work that you're doing for the community and for other vulnerable communities as well.
Thank you so much. And I'll turn things over to you all. And thank you for the opportunity.
Thank you so much. Great. So on that note, let's continue with some of these great questions that we've been getting in. Dr. Kirkley, I wanted to go to you if you wanted to build on anything that the Admiral just said. I think particularly around the issue of working with other agencies and departments to include these equity issues and sort of embed them in the culture, but also in the law. And what efforts are you making as a company to help to foster some of those changes, if any?
Yeah, for sure. Great question. There's a couple things that resonated there. One is, like you said, how we collaborate with other organizations as a healthcare organization ourselves. but also something that Admiral Levine said, which is the power of data. And I'll talk about both of those. On the collaboration side, we spent a lot of time so I'll take a step back. Our vision is to transform healthcare for every trans life, right? So we see ourselves doing that in a number of ways. Certainly, first and foremost, by direct service. We provide healthcare to the community, but also getting to the data piece. We have a lot of patients under our roof, and being able to utilize that information to inform not only our care, but the standards of care broadly when we talk about gender-affirming care and care for the trans community, and how that can be utilized by other healthcare organizations, and then also policy change. And so that gets to what I was about to say, which is we've spent a lot of time talking to legislators, talking to congressional offices, talking with Admiral Levine about how important it is to have access to healthcare for the trans community, and looking at the different aspects of that, because there's many things. We think about if it's telehealth access, access to safe care, to high quality care. You can look at broadband access within that, how certain medications are regulated in this country, right? And knowing that this care is life-saving. And so that is one way that we certainly collaborate. We, look at other organizations who are doing this work, like the Transgender Law Center, National Center for Transgender Equality. There's many groups out there who are doing some phenomenal work when it comes to policy change, and specifically health policy change. And so that's one example. And on the data piece, for us as a clinical organization, if we can show, which these are things we all know as a community, right? But if we can actually show in numbers, and in large numbers, that access to healthcare, access to gender-affirming care, access to things like gender-affirming hormone therapy are meaningfully changing outcomes when it comes to things like depression, anxiety, self-harm, and then the list goes on for basic primary care and preventative health outcomes. That is hard to argue with, in my opinion. And when you can really start to influence policy change and show that, in fact, this is truly life-saving care, and continue to help find ways to provide access to all communities.
Thank you, Dr. Kirkley, and that's great. And I wanted to build on that with Kris. I'm sure you have plenty to respond to here, but if you'd like to, I have a great question around how can we ensure that some of the progress that the Biden administration is making, that all of you are advocating for, is not erased or pushed back by a future administration? Are there things we can do from a legal perspective that help to embed and inculcate these changes in ways that are sustainable and long term?
Yeah, that's a great question. So I would say a couple of things. I mean, one, I guess again, to name that we're in a moment where trans people, our rights and lives, are being targeted by conservative right forces in order to build their base and for them to remain in power. And that it's really a continuation of what we experienced under the last federal administration. And I will say that what I think has allowed us to do all we can and do what we've always done, honestly, to fight back and fight for our rights and lives and our community is really the incredibly powerful local trans-led organizations all across the country, who have always existed, and during the previous administration did all we could. And in this moment of escalated attack, are organizing in just incredibly powerful ways. Like, I'll give a really concrete example of Texas. So when the Texas Attorney General proclamation happened, the group in Texas is called TENT, the Transgender Education Network of Texas. And they were working round the clock, fielding calls from families, from trans young people who were just so scared and confused about what was happening. And they also organized powerful gatherings for trans people to come together, to build community with each other, to let folks know that they were not alone, and to speak out and to protest against what was happening. They called on everyone across the country to convene at a hearing that was happening of Child Protective Services in Texas, and for people to speak out against this horrific policy that Texas was trying to implement. So while I believe that there's so much that we can do with litigation, I also think that the types of work that trans leaders are moving on the ground and have been for so long are just as critical, and honestly are what is really going to sustain us during times where we're in a moment where we're under a much friendlier federal administration, yet we're still facing such an escalation and attack, including in terms of the violence and intolerance that trans people are facing. I mean, I think it's important to name that we've seen this escalation in terms of state level anti-trans legislative attack over the last couple of months. And it's not disconnected from the types of violence that we're seeing, possibly targeting pride events or drag queen story hours here in California. Like you can't separate those two, because they're really coming from the same forces who are really just trying to spread hate and intolerance. So that's a really long way to say, like, yes, absolutely. We will continue to litigate. We will continue to fight back in the courts. And what's as important is the types of grassroots, trans-led, community-led organizations who are really keeping trans folks alive during this time.
Thank you, Kris. Thank you, and again, thank you for sharing the naming all the other challenges, including the violence that's happening against the trans community. Dr. Kirkley, I wonder if we can go to you in terms of how you see Plume working in concert with some of the other organizations that are working, almost cross-sector, like Kris is, in terms of legal advocacy. How does Plume view that, or how do you view that personally, in terms of, if we can provide more health equity and access, do you think that will have an impact kind of downstream or in some other ways on some of these legal issues that are confronting the community?
Yeah, for sure. I mean, it gets back to a lot of what I said previously around, again, it gets beyond just the individual patient, which is critically important, but understanding how we can change and mold systems. For us, we think about that when it comes to, of course, healthcare delivery, care design, but the policies that impact our patient population. So whether that's, maybe broader reaching things like we've seen in terms of criminalizing providers, but all the way down to how we're regulating access to certain medications, how they can be prescribed, how they can be refilled, has it happened in a virtual or an in-person environment, to even just comfortability and access to things like telehealth, which we know is there can be challenges with that, but for many communities, and especially marginalized communities that have difficulty accessing safe care in a physical space, can be critically important. So there's a lot of issues there. And again, it comes down to partnering with, I think, organizations like legal advocacy organizations. As Kris mentioned, so many amazing community organizations. We, in fact, started from a very community grassroots approach in terms of partnering with folks in the community, spreading the word, about what we do and understanding what the needs are of the community. So that's been something I think that we've always tried to have a part of what we do. And of course, we'll continue to. And yeah, so I think there's many ways and many opportunities when it comes to partnership. I think getting to like the clinical research side, that some questions have come up on that. I also think about how we can partner with, for example, academic institutions and other healthcare organizations that are really pushing care forward for the trans community.
Thank you, Dr. Kirkley. It's really helpful. Kris, I wanted to go to you. That we got a great question about how can we serve and empower queer youth and trans youth. Can you talk a little bit more about those services that maybe you're offering, other organizations are offering, particularly around homelessness issues or related issues affecting youth?
Yeah, absolutely. That's a great question. I mean, because part of the reality, right, for trans communities broadly, and specifically speaking to trans young people, and particularly trans youth of color, is that even before this period where states are literally attacking trans youth's ability to just live their life, whether it's playing sports or healthcare or whether or not they're named in schools, trans young people were already facing such high levels of harassment and discrimination and just lack of having the ability to have their basic needs met. I believe the statistic is that nearly 80% of transgender students report harassment in schools, and 1 in 6 so severe that folks end up being pushed out and having to drop out. So I think it's just important to name that for trans youth in particular, that folks were already facing so many challenges even before this period where they're targets of the conservative right. And that said, trans youth have been on the front lines of fighting back against these bills for many, many years, telling their stories, speaking to legislatures, speaking to the media. And at TLC, we have a project that's a partnership with a group called GSA Network. They're a national queer and trans youth organization. They've been around for a while. We've partnered with them for quite some time. We've had a partnership since probably about 2014, 2015 for a project called the Gender Justice Leadership Project. It specifically was built to support trans youth, particularly trans youth of color leaders around the country, to gain leadership skills, to learn about storytelling, and also to really build with each other. And this was even before we were seeing these anti-trans bills in the states, but it was clear because of the conditions folks were already living in, there was a need for trans young people themselves to be able to say, these are the types of things that we're facing, these are the issues and the needs that we have, and these are the solutions. Trans young people know better than anyone else, like what it is they need and what the solutions are to fight back against these attacks and to also get their needs met. So, in the last couple of years, as we've seen this escalation in terms of anti-trans legislation, what I've been really inspired by and found so powerful is that trans youth leaders have been so clear about what is needed. And I will say also, more often than not, if there's like a panel, if there's a conversation that's happening about these bills, there's not a trans young person on that panel, right? So there's a general erasure, unfortunately, that happens of their voices, and leadership, which is so needed right now. But they've been so clear. One, like, of course, we need these bills and these attacks to end, but they've been so clear that there's a real need for messages of hope, whether it's from adults, whether it's from allies, whether it's from other young people or trans youth themselves. So they organized this campaign a year or two ago called Love Letters to Trans Youth, where they asked people to send love letters from all across the country that we could then push out and be clear that there's hope and there's power and there's possibility even in this moment of escalated attack.
Yeah, incredible work. And thank you for also naming a lot of the work that trans youth are doing and the leadership that they're providing. I wanted to build on that because from our perspective at our organization, Movikarma, we do a lot of work in cultural equity issues, including with queer youth, trans youth around particularly their creative talents in entertainment, and whether they want to be writers, directors, or work in the industry in some way. So I wonder, Dr. Kirkley, I'll throw this to you. I know you do a lot of work in partnership with influencers, with cultural leaders and activists who identify as trans or otherwise are in the queer community. Could you talk about how you see that intersection in terms of, cultural change and the power of storytelling to foster, a more equitable society, if that's a connection that you see?
Yeah, absolutely. I think a lot of, in terms of creating equity, it does come down to representation and inclusion, and I think we think about that, of course, in how we're building a healthcare company, but it is interesting to think of the intersection with other elements of society, and to have a clinical organization that currently is taking care of 10,000 patients. I think in the near future, could be easily taking care of double or triple that, across 50 states, and really brings, I think, an element of visibility, at least when it comes to gender affirming care, that could be hard to find historically because of elements of oppression, right? That trans care oftentimes gets pushed to the corner of clinical organizations across the country, and there's some amazing ones who are doing great work, but those are can be few and far between. And so even just looking at that as a way to I think raise awareness of what we were talking about before with Admiral Levine, right, of the trans community and the needs that are there, and that that trans folks are really out there in large numbers and a lot of different spaces. Yeah, and I think anything we can do in terms of providing a platform for that visibility, in terms of, like you said, partners within those different parts of society and other industries is exciting, and I think something that we haven't seen a lot in healthcare, and so something we always try to think of, like, how can we push the boundaries of what we do as a healthcare organization, which again gets back to I think the needs of the community and how folks view their own participation in healthcare, which is unfortunately something that healthcare organizations have not oftentimes centered or asked the patients themselves, like what is meaningful for you.
Right, the notion of patient-centered care, which I know is kind of oddly a newer stream of thought sometimes in the healthcare space that I know you're working a lot on. Kris, I wanted to throw that same question to you, just around how do you see your work at TLC in terms of from the legal side, then connecting or intersecting with cultural advocacy or cultural equity and leadership, and in terms of maybe trying to raise awareness, as Dr. Kirkley said, or fostering change through cultural and creative leaders that might be out there.
Yeah, absolutely. It's a great question. I do think it's also important to really name that the heightened visibility that our communities have right now in popular culture is pretty new, right? I mean, we're really talking like within the last decade. I mean, I remember when Laverne Cox was on the cover of Time magazine. Like, I literally remember that day. And I had just started at TLC. I had been doing trans work for some time. And, I will say the level of visibility that we've seen over the last decade, I did not think that I would see in my lifetime, honestly. So I just think it's important to name that this shift is relatively new, and it is incredibly powerful. Like, I remember I was on a plane, and we had tried to get a copy of Time magazine, like myself and a colleague, and we couldn't. But then someone sitting right in front of us was reading it. So we were kind of trying to read over their shoulder to see what the magazine said, because we were so excited. I mean, something like that had never happened. And Laverne Cox herself is so amazing and such a powerful advocate for our communities. So it's relatively new. And I think what is true is that while there is this greater level of visibility in terms of popular culture, like movies, magazines, books, TV shows, and so on, that the conditions that trans people are living in, from the anti-trans state attacks to just generally our ability to survive and thrive on a daily basis, continues to be really challenging. I mean, as it has been for some time, that has not fully shifted because of the level of visibility that we've been able to gain. That said, one of the ways that we think about it is that how can we raise up the stories and the narratives that are least likely to be told, right? And some examples of that are folks have already raised up the incredible violence and the murders of trans people here in the United States. I mean, last year, as has been true for the last couple of years, has been the most reported murders of trans people in this country, of which the majority are Black trans women and femmes. So how do we name that? But also, how do we tell the stories of the incredibly powerful Black trans women and femme leaders who are organizing in this moment and doing all they can to keep trans people alive and thriving, from projects like My Sister's House in Tennessee, that are really providing housing for trans people and figuring out how to do that because no one else was, you know, or figuring out how to make sure that trans young people and communities have access to healthcare. Like I think about groups in Alabama, like Take Resource Center, who even despite the laws and the attacks that they're facing are making sure that our communities have what they need. So I think it's really lifting up those stories that both name the challenges our communities are facing, but really the powerful ways that we're resisting, that we're fighting back, and that we're keeping our communities safe in ways that we always have.
Yeah, I love that. And something we spend a lot of time on as an organization is really finding those voices and empowering those voices to tell their own stories and make sure they have the resources and opportunities, whether it be at, you know, networks like, you know, HBO Max, Warner Brothers Discovery, all the way to Netflix, all the way to production companies, like really at each level of Hollywood, making sure that folks have those resources and access and opportunities, because for too long, as you've alluded to, there's been, you know, just not that opportunity for folks to tell their own stories. I wanted to go back to you, Kris, again, for one moment. So we had a great question about city governments and the role they can play in supporting trans people. Outside of voting in the right folks, what can we do to encourage our leaders to kind of hold them accountable, especially in the wake of so much violence and repressive activities? What are your thoughts on that? Because obviously a lot of these instances of whether they be violence or forms of repression are happening at the local level.
Yeah, it's a really great question. So I would say I would think about it in a couple of ways. And the first actually gets to the previous question around what folks can do to support trans youth. So, you know, while we're facing such immense attack, trans movements and organizations across the country were stronger than we have ever been. There's more organizations than there have ever been. And while folks are getting nowhere near the resources that we need or deserve, folks are getting more resources than we have in the past. And so I think one way to really support trans youth, one way to really support trans communities right now is to reach out to wherever you are. At this point in the US, there will be a trans-led organization in your state, in your city, who is in desperate need of support, whether it's like donations or just volunteer time. And I'll drop this in the chat, but there's a group I always like to lift up called the Trans Justice Funding Project. And they have basically mapped out hundreds of trans organizations all across the country. So you can really go to that site, kind of find out where you are and find local organizations who I know would love to have folks volunteer and support them. And even if it's just like lifting up the work that they're doing. So specifically to cities, so you know, if you're in a state where that's less friendly, where you're seeing these types of anti-trans attacks happen, I would say just get involved in the local trans organizations who are fighting back. I mean, that's one of the most concrete things you can do. And really, those are groups who've been fighting these things for years, if not decades, and really have a lot of expertise and experience around the strategies that make the most sense. If you're in a more friendly state, like I'm in California, for example, or New York, there's so much that is possible in terms of, and how we think about our work in California, I would say New York as well, is what can we win in California that can then be a model for other states? Like how can we continue to kind of push the line forward, even though we're in this period where our communities are facing so much attack? So I'll give a really concrete example. Here in California, in the Bay Area, there's a office of transgender rights in San Francisco. That itself, right, is like a huge win to have that exist. And they've done some incredible things at the city level. They launched a project where this was a pilot where trans people were given basically universal income. Even in a place like San Francisco, trans people face such incredible poverty, homelessness, harassment, and violence. And so putting something in that in place, or in New York City, I know folks have been pushing really hard for a long time around decriminalizing sex work and really the ways in which our communities who are, just trying to survive are often put in the way of state violence and police harassment. So I think there's so much that can happen, whether you're in a friendlier state or a less friendly state or city. But I think a lot of it is really getting engaged in and supporting the local trans leadership and the priorities that folks have set out.
Thank you, Kris. It's a really, really helpful answer. Hopefully that helps folks listening. Dr. Kirkley, we're close to closing. I wanted to give you one of the last questions here is just around a great question we had from the audience around how allies of the transgender community can raise awareness about trans equity in parts of the country or in communities where there is a lot of noise, right? Where folks maybe are not paying attention to the trans community in general and might just hear some of the attacks or the slanders against the community, might not feel like they know anyone who's trans. How do you think about that in having navigated your own journey, but also in the work you do with Plume in terms of really shifting the narrative and just raising consciousness in some of these parts of the country?
Yeah, that's a great question. I mean, honestly, I think Kris spoke so elegantly to many ways in which you can do that. I think educating yourself and volunteering are probably the two best ways that you can do that. As Kris noted, many organizations locally that do this work that you can volunteer with, in terms of educating yourself, that will come by working with these organizations. And there's a lot of resources out there. I think places like the Transgender Law Center and the HHS, right? Two organizations represented on this session today, where you can actually read about and see the things that are issues that organizations are working on. So I think, to put it simply, just educate yourself, volunteer is a great place to start. And with that, you'll find connections to other people and organizations and can, get deeper into the space. But yeah, that's
great. Yeah. Thank you, Doctor. Okay, great. Well, let's wrap up with our last question here that we like to give to a lot of our guests on our podcast and the work we do, which is, what gives you both hope on these issues of trans equity? And as part of that question, what is the world that you would both like to see? We've talked about a lot of difficult stuff today, a lot of the negativity and kind of anti-trans forces out there. But I'm wondering, what gives you hope in these issues, and what is the world you'd ideally like to see that in your view would be, fully equitable, fully inclusive, and the kind of place that we'd all like to live in? Kris, maybe I'll start with you.
Yeah, such a great question. Despite these times, there is so much that gives me hope, and a lot of it is that I know that as trans people, particularly as Black and Brown trans people, that we have always existed, and that we have been here before. Like, we have faced this level of attack before, and that we have survived and we have thrived. And in the words of Miss Major, an incredibly powerful Black trans leader and elder for our communities, and we are still here. So I know that, and that always brings me a lot of hope and power. And I also see the ways that even in this time, we are continuing to create bold and powerful and beautiful visions for our communities. And one really concrete example is TLC, along with a coalition of majority Black and Brown and migrant trans leaders from all across the country, a couple of years came together and we launched the Trans Agenda for Liberation. I'll drop it in the chat. It's a community-led guide towards the world that we deserve. It was created through years, honestly, years of community conversations and strategy sessions to really lay out the work that we still have to do and build on the work that has been done. So I continue to be inspired by the ways that we still are bold and we still are powerful even in these times, and the ways in which we continue to win, even in small ways. So those are a couple things.
Really, really lovely and powerful. Thank you, Kris. Last word to you, Dr. Kirkley. What gives you hope, and what does the world look like in terms of the one that you're building towards at Plume and the work you do?
Sure. Yeah, I mean, I agree. I think the resiliency of our community certainly is one of the things that inspires me the most. I'm in a privileged position where I get to see and talk to patients every day who, who say, in fact, how life-saving care like this can be, right? And seeing people turn their lives around, have more confidence, see their mental health improve, and it's seeing those anecdotes over and over again. And that certainly gives me hope. And I think on a larger level, on a systems level, again, we talk to a lot of organizations, corporations, every day in the healthcare sector, whether it be the health insurance sector, pharmaceuticals, policy, regulatory, and it's changing. It's been a long time coming, but it is really starting to change. And I think in a meaningful way that we haven't seen before in terms of this recognition of even health equity. What does that mean? It's a term that's been said and thrown around for a long time, but I'm seeing it show up in a different way now. And so that also gives me hope. I think the systems are actually changing now in a way they haven't before. And I think a world that I'd love to see is just where everybody can be able to live their authentic self, to go about their life in a way that feels true to them, without intimidation, without oppression, without violence. And I think that is the core of what makes us all healthy and happy, right? So I'd love to see that.
I would too, and thanks to both of you and all of you listening for the work that you're doing in your communities, and keep going. There's a lot to be hopeful for. We're really grateful that Dr. Kirkley, Kris, Admiral Levine, all of you joined us today, and keep doing the incredible work that you're doing. Again, you can learn more about our guest work on their websites. We'll link that to this session. But Dr. Kirkley, Kris, thank you again for joining us. It was a real honor.
Yeah. Thanks for having me.
Thanks, everybody. Have a good one.